Hello and welcome to the Pricing Show. And today I have founder of SeamlessMD, Joshua. Joshua, take a minute and briefly tell us all the people, other than what I've said, your brief intro.
Awesome. Well, Vivek, thank you so much for the chance to be on this show. Hi, everyone. My name is Josh Liu. I'm one of the founders and the CEO of SeamlessMD. I started off in medicine about 12 years ago, then fell in love with using technology to improve healthcare, and it's been my full time gig building SeamlessMD for the last 12 years.
12 years. Wow. I want to go slightly even before that. Tell me a backstory. So let's go back in time and tell me about your upbringing. Where were you born and raised? And were you, an entrepreneurial kid with a lemonade stand, or either of your parents were were an entrepreneur?
So I was born in Toronto, Canada, born and raised there. I was always very much a builder in different ways. So for me, when I was in, let's say, high school, I was starting a lot of school clubs and nonprofits, and those weren't quite businesses, but it taught me a lot about just like going from zero to one, leadership, teamwork, stuff like that. And then when I got into university, I actually started a blog to just share what I learned about applying to university and scholarships with other students. And then when I actually got into medical school, I ended up sort of commercializing the blog, and like I had a bunch of traffic. So then I actually started um, a small consulting side business around admissions to university and med school. And so like that was a bit of my foray into, let's call it, going from building non-business things to kind of small businesses. But it wasn't until I actually started my current company that I really went kind of full time on an actual entrepreneurial endeavor. But I think I've been entrepreneurial in different ways growing up for sure.
And your parents, either of them was an entrepreneur or is an entrepreneur?
Not formally, but like my parents definitely weren't risk averse. My father moved to Canada when he was his last year of high school, kind of on his own with just an older sister. And then my mom came with him, several years after that. My dad worked at a startup at some point in his career, so there was always a bit of like an entrepreneurial, I think, vibe inside the household at different points. But I would say I'm probably the first like entrepreneur in the family.
Wow, I always ask this question, especially to the first generation, is like, there's this mindset of security and survival, especially the first time immigrants as they come in. And it takes a lot of work in the mindset to take that leap to entrepreneurship when you are the first one in your family. So tell me, was it a thing for you as well? Like, hey, I'm going to do this. And did you have to mentally prepare, and even like your family as well?
Honestly, I'm so blessed. My parents kind of moved to Canada. To your point, as immigrants, they were in full time survival mode, right? I don't think it would have been reasonable for them to even think about going off and doing their own thing. Whereas, like, I'm so blessed. I grew up in a household where I was so well supported by my family that I could, afford to go off on a whim and try entrepreneurial things. I think that if I was in my parents' position, entrepreneurship probably wouldn't have been very much on the radar. So if not for their support, I don't think I would have had the confidence or flexibility to try entrepreneurial things. Whether that be building nonprofits in school and then actually starting a business later on. I mean, to be fair, the other thing too was, and we'll get into the story in a little bit, but I started my current company in my last year of med school. I got into residency and then decided to put that on hold and build the company full time. But I had that safety net where if the company failed in the first year or two, I could have actually gone back and done my medical residency and been just fine. So I think I've just been frankly very lucky to have had a lot of safety nets so that if something went wrong, I had something to fall back on, which is not necessarily the case for a lot of people.
I always like to say, like, this is the opportunity we should give shout out to your parents to make you feel that it's a privilege to have that. So to Josh's parents for
Absolutely,
making
it's
him
been a privilege.
providing him
And
the
you know, I
safety net,
mean,
and that's the reason he's building this company. So we are glad for that.
thank you. Yeah, and look, here's the thing, right? When I started it, they didn't fully get it, right? Because you can imagine, they immigrated here. They're really proud that their son got into medical school. He's going to be, physician with a stable career, and now he's saying, "Oh wait, no, I'm going to give that all up and just start this company instead." It sounds a little wacky, right? But I've been very lucky that they've been supportive, and it's worked out pretty well. So I think they're okay with it now.
That's good. About what happened at the med school, and what was the moment that you were like, you know what, now I got to get out of this and build this company.
So a lot of people when they go into med school, they know what they want to do, right? They know that if they want to be a cardiologist or a family doctor or a surgeon. I was one of the folks who didn't know what I wanted to do. I didn't fall in love with a certain type of specialty, and to be honest, I felt kind of lost going through med school. But then I got lucky in that I had a mentor that I found who said, "You know what, Josh? Why don't you come spend a summer working in an innovation center that he has started, where he actually brought together designers, engineers, and clinicians to work together to solve some of the most challenging problems in healthcare." And it was in that summer kind of research experience that I learned about this problem of hospital readmissions, and I became very passionate about that topic. And then, long story short, in my last year of med school, I met a couple of brilliant engineers. We did a startup incubator together, and we said, "Hey, why don't we go and build technology to better manage patients outside the hospital to prevent something like a readmission?" And so we started SeamlessMD in my last year of med school. I graduated, was supposed to start residency, never did it, as it turns out. I went full time on the company, and that's been my main gig ever since.
And can you also please tell us briefly what Seamless MD does and what is the offering itself for whom?
Yeah, so the analogy I like to use is travel. So imagine you're driving from point A to point B. A long time ago, you had to use paper maps, but now most people will use GPS. It's faster, safer, better. And the thing that's been crazy to me is that a patient journey for, let's say, going through a surgery, a cancer, a chronic condition, those journeys are far more complicated than travel, but we don't give patients a GPS, right? We give them paper and verbal instructions, which they tell us they forget, they lose, they're hard to follow. And the healthcare team feels as if we're sending a patient into a black hole, especially outside the four walls. And we have no easy way to know if a patient is doing well or not doing well. And if patients can't stay on track with their instructions, and if your healthcare team doesn't know what's going on with you, that can lead to avoid unnecessary use of the hospital, longer stays in hospital, and ultimately higher costs for the healthcare system. So what CMSMD does is we basically provide essentially a GPS that health systems use to navigate patients through these healthcare journeys. So for example, let's say you were going to have major heart surgery, you would get our program on your phone, your tablet, or through your desktop computer, and you would get reminders of what to do leading up to your surgery, when to stop your blood thinners, when to stop eating and drinking. After surgery, you would get educational videos and education about how to do your recovery and your exercises. And then we'd empower you to track your symptoms when you go home. So you would track your pain, your temperature, you take photos of your incision after surgery. And then all the data we collect, we make available in dashboards that you can embed right inside the electronic health record. So your healthcare team can get alerts, they get dashboards, they can monitor you and catch things earlier. And we've helped health systems across North America lower length of stay, readmissions, mortality, decrease cost per patient, decrease ED visits. And so it's keeping patients healthy at home, but it's also improving outcomes and saving money for the healthcare system.
Interesting. So it is basically you manage kind of the care journey, but it's also care navigation on the patient side and helping them get to the whole thing as easy as possible.
Exactly. And we really focus on, like, let's call it the middle part of the patient journey. So I think of it as you have the two bookends where at the front, some companies focus on access and scheduling and bring patients into a health system. On the other end, you have some companies focused on, billing and payments. We're kind of in the middle where it's okay. We know you're going to need care, you're going to need a surgery, or you're going to go through chemotherapy or something else. We're going to navigate the patient and keep them safe and monitored throughout that middling portion of the patient journey.
And as far as your customer base is there, is it both US and Canada or elsewhere as well?
So right now it's just US and Canada, and that's been our focus for the near term. I mean, long term, like we'd love to grow into Europe, Asia, and other places, but for now we're pretty focused on US and Canada.
Got it. And is it like one segment is more predominant in your customer base versus another, like health system more than some other thing, or is it really just health systems?
So right now we just work with hospitals, or I guess larger health systems that have a mix of hospitals and kind of, let's call it, outpatient services. We do a little bit on the home care side as well, although that's, I would say, probably a newer part of what we're doing. I mean, long term, the goal is that we want to be the platform that can support patients across the entire continuum. So at some point, we'd love it to be a single patient moves through primary care to acute care to community care, and everyone's on SeamlessMD managing that patient at different points in the journey. We're not quite there yet. We do mostly kind of acute care and a little bit of outpatient care, but at some point, we want to do everything.
Yeah. Okay. And I know that you've been very vocal about your journey on LinkedIn, and I read about this that you shared the story of getting rejected by over 130 investors during your seed round, and all the challenging moments you probably had. What kept you going? And also, was there a time when you were like, "Hey, we're gonna run out of cash in like 2 weeks"? Were you close to that kind of scenario too?
So, when we did that seed round, I'll tell you that the first big mistake that we made. So, this was back in 2015 or so. And, we didn't really have any actual VC investors yet. And I was like, okay, might as well try and go big. So I, got meetings with all the big names you can think of, Google Ventures, Bessemer, Andreessen Horowitz, Social Capital, et cetera, et cetera. And by the way, I did not have a big network. I'm not from Silicon Valley, so I was just cold emailing all these tier A VCs. And I don't know if this would happen today, but back then they would all take a meeting with me. Now, none of them actually, or very few of any, would pass the first meeting. And so I spent several months trying to raise money from tier one VCs, didn't get anywhere. And then I was like, okay, like we're not ready, or maybe it's too early for these big name VCs. I got to pivot, and so I ended up just actually raising money from a bunch of angel investors instead for the seed round. But even then, I didn't have much of a network, so I would just go down AngelList, LinkedIn, Google. I would just try to find anyone who had invested in healthcare startups before. And what I meant was I was cold emailing, cold contacting all these investors. And by the way, like I contacted way more than 130. There were 130 who I met with. So you have a whole bunch of people who wouldn't even take my call. You have 130 who I actually met with, or more than that, and that's how many who rejected us. I think I estimated like less than, I think, 9% of people I even spoke to ended up investing. Now your question is like, well, how do you maintain resilience and how do you do that? I think the thing I've learned is that it's very much a numbers game. And that's true whether you're selling shares to an investor or selling product to a customer. My viewpoint is if you can get one, and assuming that they are not crazy, if you can get one, you can get five. If you can get five, you can get 10, and so forth and so forth. So I think the hardest part is getting the first one or two. Once you do that, you have the conviction, you have the belief that like, okay, it may take me 150 meetings, but I can get the 10 investors I need. The other part is like I just didn't have a choice, right? So I don't know which year it was, but there's definitely one year where I think we were raising some kind of financing round, and we were probably a few months away from running out of cash. And it's just you had no choice. And I think the thing I've learned is that in moments like that where you face true existential risk as a company, in this case, let's say a capital risk, you have to learn not to be distracted by things. Like there's so many things you could be doing as a CEO, but when you have a true existential risk, you have to learn, okay, I need to drop every other ball I've been juggling and do this one thing. If I get this one thing right, it's okay if I drop all the other balls. And for me at the time, that was raising capital. I think some CEOs make the mistake of believing they should still juggle 10 balls. Well, you actually can't in a situation like that. So focus at that point was super key.
And were you close to running out of cash at back then, or it was still you had some runway?
I mean, I don't remember the exact details. My gut is maybe we were a few months away, which I mean, depending. I mean, I know there's some who are like weeks away and then they close around, right? So a few months doesn't sound so bad, but I mean, even a few months doesn't seem like that long of a time either in my mind. So it was stressful. Yeah, it was.
Yeah. Well, I have been part of the company where I came from Europe to US, and we were running out of like 2 weeks, and
Yeah.
somehow
Well, there you go. That's really stressful.
something worked out, and then we survived. But the thing of focus that you're saying is, and also that how you said getting one customer, if you can get one, you can get five, and that's where I like. I think it's not everyone can process that in a way how you put it modestly. This is where the entrepreneurs have that courage to, or to put bluntly, like that chip on their shoulder, that they feel like they can bring in more customers, right? And that's I would rather say, like, give yourself more credit for that. Not everybody is able to do that, and so that's the big difference between you running a company versus somebody who's not running a business.
Well, thank you. I
Um,
mean, the other thing too is that people who haven't been in, let's say, my shoes before, they think being a CEO is just kind of like, oh, it's all strategy. It's like a lot of this fun stuff. It's like, no, actually, there's a lot of just I'm doing the same thing over and over and over. I am, at least at that time, cold emailing, hundreds of people, getting rejected all day long, doing the same pitch over and over, answering the same questions. It's not that glamorous, right? It's not strategy. Strategy is a very small part of what we do. Most of it is execution of the same playbook over and over and over until you get results. It's mostly just discipline, to be honest.
yeah. Um, Now, reflecting on the early days, what was the moment you knew that there is like Seamless MD was on the right path?
So I'll give you kind of two inflection points for us. Um, so we started this company in December of 2012 through an incubator, and then we went full time on it in August of 2013. But it really wasn't until I would say about 4 to 5 years after that, in 2017, 2018 ish, where I think we started to believe, or I started to believe, okay, I think there's really something here, because it was really slow in the first several years. And so by 2017, 2018, we started getting our first, so we're from Canada, right? That's where we started the company. But in 2017, we started getting our first like US customers. We started getting our first real clinical evidence that we helped reduce readmissions and hospital length of stay. We started getting our first EHR integrations with Epic and Cerner. And so things start to finally come together. So that was one first inflection point where I said, okay, like things are starting to work. And then the second inflection point was probably 2020, 2021-ish, when the pandemic happened, the world shut down. But actually in Canada, where we had struggled for many years despite building here, we finally started to take off in Canada. And what had happened was the pandemic caused a lot of major backlogs in surgery. And in my home province of Ontario, the government said, hey, like, we need to invest more in digital health that will actually get patients out of hospitals sooner and keep them healthy and safe at home. And so the government started giving hospitals money to invest in products like ours. So we actually started to really soar in our home province initially, and then later across the country, because the government started investing more in digital health. And that's a funny thing, right? Like back in 2019, our product worked just as well as it did in 2020. It just was not a priority. And just overnight, not really overnight, but you know what I mean. Let's call it like a 2 year overnight period. All of a sudden, it started to matter. So I would say those were two key inflection points for us.
Very interesting. It's like I always say, like the companies I worked with, we were like telemedicine, but we were ahead of time, so it didn't work. So we had to switch it back to being a messaging platform. And then at the end, when COVID hit, telemedicine was such a big thing. We brought back all those features back in, and that actually led to the acquisition after all, because the scale was crazy. So sometimes I say in startup world, especially early stage companies, it's just like timing plays a big role. Like you don't know, you can't always time things, right?
You
So
can't. The other thing too is that, and to your point in healthcare, it's almost like you have to be a little bit ahead of your time, so that way when the market is ready, you're already prepared. You have the tech built out, you have some proof points, you have that trusted brand. Whereas like if someone were to start that same company right, when the pandemic happened, it may be too late because they don't have a trusted brand or the proof points or whatnot. So even for us, it's like, yeah, we were really early, but then when it mattered, we were the first call.
yeah, this is I want to like highlight this point double time, that healthcare, you have to be there for some time, you need to have some sort of credibility. And this is very different from other industries like B2B SaaS or selling into marketing sales. You can probably pop up a brand tomorrow and highlight your new tech, and that might work in your favor. But not in healthcare. You have to be seen by the audience, with your market. The market wants to see you in the market for some time to trust you. That's great. Now, I guess you worked with both Canadian and American health system right now. What are the most striking differences in digital health adoption you have seen between the two, US, Canada?
So the fascinating thing is that the medicine and the actual healthcare delivery side, how we deliver care to patients, is pretty similar in both countries. And what changes the adoption of digital health, or even the types of digital health that gets adopted, really is the difference in the payment models and the incentive structures. So, for example, in the US, health systems are really run more like businesses, right? And so there are real incentives to increase patient volumes and compete for patient market share in the US. There's no real backlogs and wait lists. Patients can kind of get care if they need it. In Canada, we don't run, let's say, hospitals like businesses. Hospitals are given typically global budgets by the government. They have zero incentive to see more patients than they're asked to. There's no competition for patient market share. They're not trying to win patients from each other, and so we actually still have really long wait lists for things. Um, you don't have to pay for most of healthcare, but you're waiting longer. That's a trade off. Now, how that affects, for example, a company like SeamlessMD and adoption, I can tell you in the US, for example, there's far more incentives financially to improve patient outcomes. So, there's potentially penalties for, let's say, higher readmission rates, or even, let's say, financially in the US, if we lower length of stay for a hospital, that means increased net profit per patient. That's a real financial ROI. And so if we cut readmissions, we cut length of stay, that means a lot to a US healthcare system. But in Canada, we have a lot fewer financial incentives to improve operations and patient outcomes. So I can tell you there's been cases in the past where even if we reduce length of stay or readmissions for a hospital here in Canada, they don't make a profit. They don't have penalties to avoid. They don't feel like they actually benefited from an operational point of view. They know it's good for patients. They know that throughput is better, but they have no financial incentive to improve those things. And so that's why for us, like, we didn't see as much growth in Canada until the pandemic happened and the government stepped in and said, hey, we gotta improve throughput now. Let's invest more in digital health. And so I think that's been one of the challenges in Canada. It's great that you don't have to pay for most of healthcare, but it's not really great from a, are we trying to optimize the patient outcome and the patient experience? We just really lack those incentives.
Interesting. Uh, in general, in US markets, still from the consumer side, from patient's perspective, uh, health system or just the US health system is still viewed not in that much positive light, right? So, and we still argue, or we still say a lot about like, oh, we are in this sick care system. It's not like, and then there's so much insurance. Everybody's working for insurance. That's how it works. So there's misaligned incentives. Do you see that? I guess what I'm trying to understand is, do the people or the consumer in Canada view their health system in similar light and negative notion, or is it more positive perspective in that regard?
Oh no, it's definitely not more positive. I think when I looked at the data recently, trust from consumers in Canadian healthcare has fallen over the years, and so I mean we have a lot of room to improve on the patient experience and patient outcomes. Now, I still think most people would rather. I mean, I know, for me, I'd still rather be in the Canadian healthcare system just because the insurance and the payment issues are not, really so much of an issue. And for most people, that's probably preferred, even if the consumer experience might be worse. I can tell you, if you're a digital health company, generally speaking, you're probably better off in the U.S. from a company perspective. But if you're an individual who's just thinking about your access to healthcare and really having to pay for healthcare, you actually might prefer the Canadian system. Maybe not access, but at least not having to pay for it. Access is not great for a lot of patients, unfortunately, in Canada.
That makes sense. Okay. I have witnessed three different types of systems throughout my life because I was born and raised in India, and then I lived in Germany, very different. And then when I moved to US, very different. So I see, like obviously sometimes I feel like, wow, like I can literally go in India anywhere and get out of pocket whatever I need, like from prescription to this all the stuff, right? And then also I got really sick. Some infection happened to me while I was in Germany, and that was the most seamless experience I had in terms of like getting care, to like not worrying about admission or like anything. I didn't pay anything out of my pocket, and everything was great. So um, do you see, like, I can talk about India, that I see India kind of like moving towards the US health system kind of approach, because there is a lot of employer based insurances coming. Do you see that, or the US or the Canadian health system, or just like founders, you view one system better than another, the European versus the North American? Do you see any? What's your take on that? Which one do you prefer? I guess.
I think as a company, if you're trying to build, especially if you're trying to build a health technology company, it still feels like in most circumstances the U.S. is generally the better market. It's a much bigger market than at least like let's say Canada or Germany, for example. Um, you have because of the competition for patients, outcomes and patient experience, and using technology to improve that will still often be um, much more attractive in the U.S. than other markets. And then even unfortunately, because of all the problems with insurance, prior auth, rev cycle, like there's also these other problems we wish we didn't have, but they are problems. So then there's opportunities to build and solve those problems too. So I think for many reasons, the U.S. is still probably the best place if you're trying to build a healthcare technology company as a starting point, and then work to scale that to other geographies. Um, that doesn't mean you. I mean, obviously, we've built in Canada and serve more than one market, but then in some ways that's also harder because we have to understand two different markets right now, and just mentally remember, okay, like the value props are kind of different, right? The medicine's the same, but the value props are different. Um, Whereas I can tell you, like most of the folks I know who started building the U.S., like they don't even serve Canada at all right now. Actually, it's pretty uncommon for an American company to at least initially serve Canada as well, right? We're kind of the weird case where we serve both because we started in Canada.
Yeah. Uh, what about the challenges there, especially when it comes to scaling? Like, can you talk about customer acquisition strategies that have worked, and that those haven't? And also, I know this complexity of Canada, US. Do you focus your energy more on one market than another? Is that how that works? Give us some insights on that.
Yeah, so I would say what's been interesting is that we've had to adjust our go-to-market strategies as the market itself changed the last 5-6 years. So for example, before 2020, what we did in the digital care journey space wasn't really that interesting to the C-suite of health systems. So before 2020, we were always getting into hospitals and health systems bottom up through physician champions. So we would meet like the chief of cardiac surgery or the chief of orthopedics, and they would see value in Seamless, and they'd bring us in, and then we navigate kind of landing in an organization bottom up through a physician champion, and then try to kind of scale and grow from there. And then what happened after 2020 was that I think because the pandemic accelerated the interest and the importance of digital health, more and more C-suite executives started caring about digital health, which also meant they wanted more control and ownership top down over any patient-facing technology. And so after 2020, I think a lot of physicians probably got pushback from executives saying, hey, this really needs to be an organizational decision, let's say. And so we had less luck actually engaging physicians bottom up after the pandemic. And instead, though, we did get more kind of interest and more initial kind of conversations happening top down with C-suite executives, which in some ways I think we thought would be the case long term, and it is, I guess, generally speaking, better because if you can get the C-suite as your champions, and then they bring your product to the physicians, that's an almost easier sell than physicians trying to like convince the C-suite to do something new, right? So. But what that's meant is that our previous strategy of let's go to medical conferences, let's meet physicians, let's go bottom up stopped working, and we had and it sounds obvious now, but I can tell you as you're going through it, all you're seeing is like, wait, these physicians don't want to meet me anymore. I'm going to these conferences, they don't want to meet these. It's not going anywhere. It took time to realize, okay, the market has changed. How health systems bringing new innovation has changed. These executives who didn't care before, oh, actually, they're kind of interested now. Let's start having more of those conversations. So it took time to figure that out. But I think ultimately it's better for us because, if we can get leadership excited from day one instead of day 100 in a conversation, that's actually much better long term.
And what kind of channels are you pursuing to, or were able to be able to get this foot inside the door with these decision makers?
Yeah, well, I can tell you how that's changed too. So, years ago when we started, cold email was actually quite good. And I think because back then there wasn't as much noise, there wasn't as much, email marketing going on from companies. Nowadays, like cold email is a horrible way to try and meet people. I feel like spam filters have gotten better. Everyone just deletes their entire inbox. So nowadays, warm introductions, social media, in person at the right events, basically everything outside email has kind of been a much, much more important channel for us compared to 5-10 years ago.
Yeah, interesting. That's been my experience too. To be honest, like in 16, 17, I was the one who actually broke every email system with cold emailing, and we built $1 million pipeline. We actually ended up sending 20,000 emails in a week, and that's the kind of system we built back then. And I remember that we built like 1.2 million in pipeline, and then we closed 870K out of that. Back then, it worked, and that was the deal, especially in the private practice space in the US. It doesn't work this way that anymore. You try to do it, you're your probably reply rate is 0.02%, and that's how it is. Like, it doesn't work anymore. um, how about your company's current traction? How far you have grown in terms of, are you able to share some details on that, and also a little bit about your fundraising situation? Are you in fundraise right now, or you're good? Where are you with that?
Yeah, so I mean, we work with approximately 50 hospitals and health systems across the continent. Um, and we're not fundraising. I mean, so we last raised a round of financing back in 2020. Haven't had to raise any capital since. We've just been laser focused on let's just build a durable company. And I always think capital is a tool. So I'm not saying we would never in the future raise capital, but I think we're really focused on, okay, like let's be in a position where we don't have to be on the treadmill of fundraising to move the company forward. Let's build the company sustainably, and then later on, if we decide we want to fundraise to accelerate some specific thing, great. But if we don't want to, we don't have to. And I think that's been a healthy thing, right? I think one of the challenges that we've all seen in the markets the last few years is you had some, companies in healthcare, some not, where they, raise too much at too high of a valuation, and frankly, probably raised way more money than they should have. And, they didn't learn to be, frugal and focused, and it didn't turn out well. And I think now it's obvious to say that now, but I think most folks have realized, hey, let's just get back to basics. Let's just build fundamentally good companies, and capital should be a tool. It should not be this, increasingly growing, metric. But in any case, yeah, we're just trying to focus on building a great company.
Do you have a services component too with your, as in like part of your monetization? Do you charge for services as well?
We do a little bit in the sense that we have a model where we charge one-time implementation fees to customize and configure the platform, and train staff and all that. And then we have subscription model for kind of the ongoing software and support services and all that. But I think the bigger point is, regardless of what your business model looks like, I'm a big believer that at least for products like ours that really need to be successfully embedded into the clinical workflow, you need real services involved to understand the workflows, tailor them, support the staff well. I call it clinical change management. Like we do not sell self-service off-the-shelf products in our space. And I've seen people try to do that, and you get zero adoption. It's unsuccessful. It eventually fails. If you're doing something that affects real, significant, parts of the patient journey and the clinical workflow, it takes real services work. And I think we've learned, okay, like in the past, we would worry like, oh my gosh, like, like shouldn't we try to be more of a pure SaaS tech company? And now I've realized, well, no, for our kind of product and business, you actually can't be if you want to do it well. And the folks who've tried have not been successful.
Yeah, that's kind of how I have come to this realization too. Like, somewhere down the line, I would say like it's like the 2015 mentality of building tech and SaaS, especially in health tech or digital tech, was like just make sure you do this one thing right and the product works by itself, and that's what we gotta follow. And that's not true, right? Like to make, don't think about your tech, make about how it's gonna make it work for the consumer or the customer, right? And that cannot happen if you're not doing certain parts of either services or implementation or workflow, whatever you are doing for them. And on top of that, your software is gonna then do its magic, right? And that's a
Absolutely.
big and that's the biggest learning I had during this like 10 years window, that you know what, uh, we were wrong in 15 to, or whoever was saying just make sure that software is so good that they use it every day and that's how it's going to work. That's a wrong philosophy. Just focus on solving the problem and make sure customer uses your product, then you have something going on.
Absolutely.
Fascinating. uh, Tell me about AI. Like everybody is jumping on this thing, and of course, there is a big advantage of, especially on the diagnostic side, and just even processing the zillions of data sets that comes with healthcare. So, where are you with AI or the usage of AI in Seamless MD? What's the area you see like where you are using it, or you're thinking that this is the area we will be using the most?
Yeah, I'll give you my thoughts on the 10,000 foot view, and then I'll kind of bring it back to CMSMD. So, I mean, right now, the lowest hanging fruit for AI in healthcare is kind of more in the administrative, non-clinical use cases because risk is low and ROI can be much higher. So, for example, if you're thinking about patient-facing AI, let's call them conversational AI or chatbots, the most common use cases that are also the easiest are things like self-scheduling, right? Operational admin things that are low risk, relatively easy to do. But I think what we're finding is that AI for more clinical use cases. So let's think about what if we were to create an autonomous AI agent to guide a patient through a surgery. Those use cases are very much further away because um, when it comes to medical clinical stuff, we know that a human is still needed to make sure the output is reasonable, right? So, like, when a patient talks to a clinician, we don't always fully understand the context for the treatment advice we're being given, but we trust our clinicians because they have the clinical acumen, the experience, the judgment. But you can imagine if a patient were to talk to an autonomous medical AI agent today with no validation by clinician, there's a lot of safety risk involved with that. Um, but if we give a patient a chatbot, the patient assumes that they can trust the autonomous agent. And so, for what Seamless is specifically around direct clinical care for patients, um, I would say in the near term, even though technically we could probably work on it, most healthcare systems, if not all, would not be comfortable with the idea of an autonomous AI seamless chatbot telling their patients what to do. Do I think that, decades from now, in a long enough time horizon, that could become standard of care and a real thing? I do. But I think it's a much longer path there than folks realize. And so for us, it's about what are the things with AI that we can do today to enhance what we do for patients and care teams in a way that would be accepted by the healthcare system, at least so that we can match the urgency that they have for using AI in our type of use case. And so right now, it's a lot of, like, honestly, not the coolest things, but they're important. So, for example, language translations, right? So we offer Seamless in multiple languages for different cultures. And I can tell you, in the past, no one would trust Google Translate to translate medical language because there's risk of safety and harm, and safety issues and harm. And so whenever they would translate our Seamless journeys for different languages, health systems would have to pay a medical translator to translate the instructions, the care plans into different languages, and that's not cheap. What we've done, though, is we've embedded AI into our backend where we can actually, help translate these patient journeys into different languages, like generate a draft. And then a health system typically still wants to pay a medical translator to check and see that it's still safe and accurate. But that still cuts down on a ton of money that would have been spent to pay a human to do the draft. And so, again, it's not the sexiest sort of use case for AI, but it's one of those practical things that at least gets AI being used into our product. And I think over time, as folks get more comfortable with AI, we can transition to more of these AI kind of native experiences for patients for clinical care. But I don't think the healthcare environment is just ready for that yet, and we want to match that urgency in the way we design the product.
That's very smart. I think what the point you're trying to make here is, especially the scope where your product exists in this ecosystem, that's more clinical, and you want to keep it with the pace and confidence of the market. But you are happy to use it as a tool and enablement tool for everything you do outside to maybe build these solutions, or even, I don't know, synthesize information in whichever way to provide these things. Um, okay, so now, is do you think that something in the future, let's just a little futuristic view of how you view healthcare or digital health, is there one trend that you are outside of AI that you're most excited about, and you think like this will be really great in next 5 to 10 years?
Yeah, I mean, honestly, I'm kind of biased. I think it's kind of what we're working on right now here at Seamless. I mean, it goes back to what we mentioned earlier, where there's the last 5 years, there's been so much innovation focused on the bookends of the patient journey. Let's bring them in the door and get them to schedule and get into the healthcare system, and then we've innovated a lot and still doing more on the other end, billing and payment. But to me, it's still like, how do we optimize the patient journey? How do we ensure that once they're going to get care from you, they're getting the best care possible in a scalable way? And even you're seeing it now with AI, where a lot of AI is being applied to the bookends, to the administrative operational things. And so that's also why I believe that things like Seamless around the care journey will start to proliferate more in the next 5-10 years. And then over time, as we get more successful at the clinical side, we will layer in the AI pieces. And so I think you'll see things like Seamless grow with less AI the next several years, and then the operational things grow more with AI. And then I think, in 5-10 years, you'll see more AI layered into what we do in the care journey side. But for me, I still think that's the biggest leap. I think it's just recognizing, okay, we need to get more technology into the actual clinical parts of the patient journey. Because if you think about the stuff that we call digital health a lot the last few years, it's things like what's really taken off. I mean, telemedicine, but you're digitizing a visit, right? Like, and my thing is that, well, the visit represents a very small portion of the actual care journey, right? It's everything that happens between the encounter with the patient and the clinician that, in fact, arguably has a bigger impact on the outcome of the patient. And so I think that that's the big part that digital still has to do a lot better a job at getting into.
It's a very important point that that's why we see a whole bulk load of companies coming in the administrative part of the patient journey versus the clinical part. And like you were saying, how sometimes like digital health is mostly the administrative part rather than the clinical part. So that is for sure. Like my observation is a similar way, and now that you pointed it out, so that's a great position for Seamless to be in. Let's say that. So that's a
I
good
hope so. I'm betting on it.
yeah. Okay. Now, to conclude the show, a couple of personal questions. So, what would you tell a medical student, maybe like you who was in med school, or a clinician thinking about starting their own health tech company today?
So I think a big thing a student or a clinician has to think about is if they're starting something, do they want to start a passion project or do they really care about building and starting a company? And I say that because there are a lot of really great health tech ideas and projects that can help a patient, can help a care team, can help the healthcare system, but don't really have a shot at becoming a true company because it's honestly a vitamin and not really a painkiller that the market is desperate for. And so if you want to, if you're passionate about this specific idea and it is a vitamin and you want to build it anyways, like that's totally fine. You should go and do it. But if your goal is to build a true sustainable healthcare tech company, before you build anything, you probably should just go and do real market and customer validation to find out, hey, will someone actually even pay for something like this? And people end up being surprised because a lot of times we assume that if we're helping a patient, someone will pay for it. It's not true for a lot of innovations, unfortunately. And I find something very common is that things are built internally, let's say in a hospital setting where you're a clinician, you have a great idea, your hospital lets you build it, they support you, they may even like give you like resources to do it. But the reality is that you're assuming because your hospital supported you, that means other hospitals, for example, would pay for it. There are a lot of times where even your own hospital may not have paid for it, but they're not going to tell you that because they're going to support you. They're emotionally invested in you. And so I think people have to realize, is this a passion project that I'm okay if it doesn't turn into a company? Or is this something that I just want to do if it can become a company? And that really should change how you approach building it.
Interesting. Um, I I I think for sure, in healthcare, and I've learned this lesson from my experiences in the beginning when we were trying to do um, when we came to the US market as a telemedicine solution, and we focused specifically on dermatology segment. And one of the thesis we had was like, hey, uh, these people love doing telemedicine, they will do visits. And we said, okay, let's just make it B2B, give it to them and see they will use it. But the product itself wasn't, or the app itself wasn't integrated into their practice. So what we saw, nobody's using it. Even there was people paying for it, but yeah, you can, they were paying a little subscription, but nobody was using it. And then that was a big rude opening for, or at least at that time, was that, you know what, this product has no use. It's just sitting in their thing, and we got few customers. And a good and this reminds me of the exact same thing. Like sometimes health systems, they're almost like corporate venture capital arm, and they want to put money and experiment and see if they can get something out of that. But they will also pull it back when they know it's not going to work, or it's not going to going to be the real use case. Really interesting observation there. Okay. Uh, Last one is a fun question before we conclude the show. And I ask all my guests. So tell us about a personal thing that you or that no one in your professional circles knows at the moment, but this is something you would like to share now. This is your chance to let the world know. Could be anything, that you feel is appropriate to share. Anything that you like to share.
Yeah, I mean, I'm a huge basketball fan. When I was a kid, I grew up wanting to be, a basketball sportscaster. Maybe one day I'll still get that chance. I'm not sure I'd be great at it, but I I think it would be fun to do. So if someone wants to get me a job as an ESPN NBA analyst, let me know.
There you
I'm
go.
still in the market.
That's a good one. Well, you might get some calls from here. People just reach out to Josh for this. This will be great. All right, cool. So, last but not the least, where can folks find you? How if they want to hit you up or connect with you? What's the best way to get to you?
Yeah, you could find me on Twitter at Joshua PLAU or just Joshua Liu on LinkedIn. It's probably the best ways to reach me.
All right. And Josh, can you also tell your company's website for everyone so we can make sure that people want to go and visit your Seamless MD's website?
Definitely. It is www.seamless.md.
All right, cool. Well, thank you a lot. A lot we learned from this podcast today. I'm sure my listeners and everybody who's listened will take a lot of good insights from your journey that you shared. And I think personally, I feel very bullish about what Seamless MD is doing now. I have a better understanding of it. And I actually think that not only you have a competitive advantage because you're tackling that patient journey with from a clinical perspective, but I also see that that's a less crowded part of healthcare. So you have a great opportunity existing there as you're doing it. So yeah, I'm bullish. I'm bullish on Seamless MD,
Thank you.
and wishing you best for all the work that you guys are doing. Really good job, and thanks for taking the time to be here.
Thanks, Vivek. Appreciate the opportunity to be on your show.